Welcome back to Generation Sick, the power, politics, and propaganda behind America's health crisis. Written by Dr. Vic Naumov. Copyright 2016. All rights reserved. Last time, Dr. Naumov laid out why he wrote this book and what he means when he talks about the control system. Today, we go into the first two chapters of the book itself. Chapter 1 asks a question that sounds simple, but isn't. Is the glass really half empty? And Chapter 2 takes us back, way back, to understand exactly how American medicine ended up organized the way it is today, and who built it that way. Let's get into it. Chapter 1. Is the glass really half empty? Dr. Naumov opens this chapter with a quote from a man most people have never heard of, but whose ideas shaped the entire 20th century. Edward Bernays, the father of modern public relations, and Sigmund Freud's nephew. Bernays wrote about what he called the invisible government, a small number of people who understand the mental processes of the masses and who, in his words, it is they who pull the wires that control the public mind. End quote. Edward Bernays. Dr. Naumov wants you to sit with that for a moment, because everything else in this chapter builds from it. In his own words, here is Dr. Naumov. In politics, there is no one-size-fits-all solution. Where you stand depends on where you sit. Your economic status, your ethnicity, your education. Dozens of factors shape how you see the world and how you vote. A glass that's half empty is also half full. It's your own mind that decides which one you're looking at, not the actual measurement in the glass. But here's the thing. Your view of that glass can be shaped by somebody else. If someone tells you, half full is right and half empty is wrong, often enough, convincingly enough, you'll start seeing it their way. And that exact kind of perception management, Dr. Naumov argues, has been used for decades to shape how Americans see healthcare reform. Think about it this way. Both Hillary Care in the early 90s and Obamacare almost 20 years later were rolled out to the public the same way, as compassionate plans to get medical care to people who couldn't otherwise afford it. But behind the announcements, both bills were actually built through secret strategy sessions, political horse trading, and backroom compromises. And the controversy the public actually got to see on the news? It was almost entirely about the size of government, whether this was creeping socialism, whether it would bankrupt the country. Meanwhile, the deeper questions, which treatments would get covered and which wouldn't, which specialists' patients would be steered toward, how insurance companies and financial interests had come to outrank doctors and patients in decision-making, those questions barely made it into the conversation at all. And it's not just the obvious channels either. Dr. Naumov is blunt about this. The mainstream media's range of opinion is narrower than it looks, because even the so-called alternative outlets, networks people think of as opposition voices, are owned by media conglomerates with their own healthcare stock portfolios and their own financial stake in how this story gets told. So instead of an honest national debate about what treatments and procedures actually make Americans healthier, the public got a sideshow, fighting over whether Obamacare was a socialist plot or a sellout to insurance companies, while the actual state of American health just kept getting worse underneath all the noise. Rising rates of chronic disease, a slowing rate of life expectancy gains, a flood of side-effect-heavy medications. By any honest measure, Dr. Naumov argues, the quality of American life has been quietly declining for years, reform or no reform. So, was there really a healthcare crisis in America, serious enough to justify reshaping a sixth of the entire U.S. economy? Dr. Naumov walks through both sides of this fight, going back to 1993, when columnist Fred Barnes argued in the Richmond Times-Dispatch that there was no healthcare crisis at all, pointing out that most Americans, according to the polling at the time, said they were satisfied with their own care. Barnes accused the press of, in his words, trumpeting the crisis theme. End quote. Fred Barnes. Barnes's argument was that America's real healthcare cost problems traced back to specific, identifiable causes. The expense of AIDS treatment, the cost of treating drug-exposed infants, and the multi-billion-dollar burden hospitals absorbed every year, providing uncompensated care to people who couldn't pay. His conclusion was that America had little to learn and nothing to emulate from other countries' healthcare systems. Dr. Naumov doesn't tell you which side of that argument is correct. He's upfront that this is a genuinely complex question, and he leaves it to you, the listener, to make up your own mind. What he does argue is this: whether the crisis was real, manufactured, or somewhere in between, the solutions that emerged, backed by the insurance giants and financial interests behind Obamacare on one side and the billionaire-funded, ultimately non-existent Republican alternative on the other, did almost nothing to address what Americans actually need to get healthier. Here's how he puts it. The government's role in healthcare, in his analysis, is set by the wishes of what he calls big finance. And it barely matters which party is nominally in charge. Democrats and Obamacare, in his view, deliver a marginal improvement in access for the relatively small share of people who genuinely couldn't see a doctor before, while pulling enormous amounts of taxpayer money into subsidizing unnecessary procedures, ineffective treatments, and medications that, in his words, make people sicker rather than better. The end result, as he sees it, enormous profits for insurance underwriters, drug manufacturers, and pathology labs, and more families hearing the bitter old joke that the operation was a success, but the patient died. And Republicans wouldn't have fixed this either, in his view, possibly the opposite. Lower the tax burden, sure, he argues, but watch medical bankruptcies climb. Watch preventable and contagious conditions go untreated. Watch emergency rooms become the only healthcare option for millions of people who can't afford anything else. There's one group, Dr. Naumov argues, who'd be perfectly happy watching both parties fight to a standstill forever. The bankers and financiers on both sides of the aisle, who can't actually agree on the best way to keep their own profits flowing, which, in his view, is exactly why this fight never really ends. What most people don't fully appreciate, Dr. Naumov argues, is that Obamacare's intellectual DNA is far more Republican than the public debate ever let on. He traces its core mechanics, the individual mandate, the employer mandate, back to managed competition proposals that originated at the Heritage Foundation, a conservative think tank developed with backing tied to Rockefeller-aligned interests decades earlier. His argument, had the 2008 election gone differently, we'd likely have gotten a substantially similar policy under a different name and a different president. In his view, once what he calls the control system had settled on this prescription, no single election outcome was ever going to change the destination, only the name on the bill signing it into law. Dr. Naumov lays out what he calls the control system's basic playbook. And it's worth hearing in full, because you're going to see this pattern surface again and again throughout this book. Create a problem. Wait for the public to react to that problem. Then step in with a solution to the very problem you created in the first place. In the case of Obamacare, he argues, The manufactured sense of healthcare crisis was the problem. The public outcry, millions of Americans worn down by stories and messaging carefully designed to make them uneasy with the status quo, was the reaction. And the signing of the Affordable Care Act into law in 2010 was the solution. Dr. Naumov draws a direct parallel to how, in his view, this same three-step method had already been used a century earlier to pass the Federal Reserve Act of 1913. Another moment, he argues, when a manufactured financial crisis, amplified by a cooperative press, produced exactly the reform that a small group of financial interests wanted all along. It's bankers, not politicians, Dr. Naumov argues, who hold the real decision-making power in America, and the wealthiest financiers understand, better than anyone, the value of creating what looks like social progress. That's how, in his telling, we got the income tax. That's how we got Social Security. That's how we got Medicare. That's how, again and again, we get pulled into wars. He's careful to note that many of these programs may carry real benefits for ordinary people, but his point is that none of them, in his analysis, would ever have happened without the active backing of powerful financial interests who saw an opportunity in them. And today, Dr. Naumov argues, those same financial interests have found something even more lucrative than issuing credit cards or foreclosing on homes. They've found healthcare itself. Banks and financial institutions, in his analysis, now sit at the center of insurance, pharmaceuticals, hospital systems, medical technology, and logistics, and every dollar that flows into expanding the healthcare system, every new hospital wing, every new piece of diagnostic equipment, every new round of robotic surgery adoption, ultimately flows back to investors in the financial sector. That, in Dr. Naumov's view, is the real reason so much sustained effort has gone into expanding America's healthcare infrastructure over the past century. Not because the system was failing patients, though he argues it clearly was, but because the system, properly understood, was never fully designed to put patients first to begin with. So if that's the politics behind America's health crisis, where did the underlying system itself actually come from? For that, Dr. Naumov takes us back further than you'd expect. Not to 1993, not even to 1913. All the way back to Hippocrates. Chapter 2. Profits Before Patients, the Historical Connection. Dr. Naumov opens this chapter with a quote from writer and humorist Michael Ellner, who once observed, "Doctors destroy health, lawyers destroy justice, universities destroy knowledge." End quote. Michael Ellner. Every new doctor in America recites some version of the Hippocratic Oath at graduation. But Dr. Naumov points out something most people never stop to consider. Hippocrates himself wasn't practicing anything close to what we'd recognize today as mainstream medicine. He used herbs, diet, rest, and careful observation of the body's own capacity to heal itself. In modern language, Dr. Naumov argues, Hippocrates was essentially a naturopathic physician, and the name Hippocratic has, in his view, been used ever since as a kind of smokescreen, lending ancient legitimacy to a system that operates almost nothing like the one Hippocrates himself practiced. What we have instead, Dr. Naumov explains, is something called allopathic medicine, treatment from the outside in, built around pharmaceutical drugs and surgical intervention rather than what he calls the wisdom of the body. And he's careful here to give credit where it's due. The 20th century brought real, undeniable gains in longevity and public health, and inventions like penicillin rightly made their discoverers into historic figures. But Dr. Naumov argues that a meaningful share of that progress actually came from somewhere else entirely: cleaner drinking water, better sanitation, improved diet, less smoking, lower air pollution, rather than from the pharmacy counter. And he points to a darker side of the ledger too: side effects, a water supply increasingly contaminated with pharmaceutical runoff, and the steady erosion of antibiotic effectiveness from decades of overuse. The word allopathic itself, Dr. Naumov tells us, wasn't coined by its supporters. It was coined as a criticism. The man behind it was Samuel Hahnemann, a German physician born in 1755 and the founder of homeopathy. Hahnemann looked at the dominant medical practices of his era: bleeding patients, forcing vomiting, aggressive purging, dosing people with toxic substances like arsenic, and concluded that this entire approach caused needless suffering rather than healing. Allopathic, in Hahnemann's original usage, literally combines Greek roots meaning opposite and suffering. And here's a detail Dr. Naumov really wants you to sit with: homeopathy, the thing most Americans today dismiss as fringe alternative medicine, was not fringe at all in 19th century America. At its height, homeopathic physicians actually outnumbered allopathic doctors by more than 2 to 1. During the major cholera epidemics that devastated Europe, starting with the outbreak of 1831 and again in 1854, homeopathic clinics reported sharply lower mortality rates than conventional hospitals treating the same disease. In Bavaria, by some accounts, homeopathic mortality ran as low as 7%, while conventional hospitals elsewhere saw death rates as high as 80%. The London Homeopathic Hospital, during the 1854 outbreak, reported a death rate of roughly 16%, compared with over 50% at hospitals using conventional treatment. So what changed? Dr. Naumov traces it to the founding of the American Medical Association in 1847, modeled directly on the British Medical Association, itself founded 15 years earlier as essentially a trade union for doctors. And the AMA's purpose from day one, Dr. Naumov argues, wasn't really to protect patients. It was to establish and defend a complete monopoly over the practice of medicine in the United States, with allopathy installed as the official AMA-sanctioned standard. One of the AMA's own early leaders makes Dr. Naumov's point for him. Dr. George Simmons, who ran the AMA from 1899 to 1924, wrote candidly that the profession's growth needed to be deliberately restricted if doctors were going to earn a genuinely lucrative living. Restricting supply, in other words, not improving outcomes, was the openly stated goal. But cutting the number of doctors in America wasn't something a single trade association could pull off on its own. It needed serious capital, and according to Dr. Naumov, it found that capital in the form of the richest man who had ever lived, John D. Rockefeller Sr. Dr. Naumov doesn't ask you to take this on faith. He traces a documented chain of events. Rockefeller's chief philanthropic advisor, a Baptist clergyman named Frederick Gates, identified the medical field as an enormous, underexploited opportunity, not just for charitable giving, but for building exactly the kind of dominant, vertically integrated position Rockefeller had already built in the oil industry. Gates pitched Rockefeller on a plan to gain effective control over American medical education itself. The first concrete step was the founding of the Rockefeller Institute for Medical Research. The second, and far more consequential step, came in 1907, when the American Medical Association asked the Carnegie Foundation to survey every medical school in the country. The man chosen to lead that survey was an education researcher named Abraham Flexner, not a physician himself, but someone deeply influenced by and educated in admiration of the German academic model. Heavy on laboratory science, heavy on pharmacology, heavy on long, expensive, hospital-based clinical training. Flexner's brother Simon happened to be running the Rockefeller Institute for Medical Research at the very same time Abraham was conducting his survey of America's medical schools, a connection Dr. Naumov flags as more than just an interesting coincidence. The result, published in 1910 and now known to history simply as the Flexner Report, concluded that America had far too many doctors and that the path forward was to make medical school dramatically more selective, more academically rigorous, and vastly more expensive, requiring expensive laboratory facilities most existing schools simply couldn't afford to build. Flexner's own words on the matter were blunt. Reckless overproduction of cheap doctors has resulted in general overcrowding. End quote. Abraham Flexner. The effect was immediate and dramatic. Within just a few years of the report's publication, the number of medical schools operating in the United States collapsed from roughly 650 down to about 50. Annual graduating classes shrank from around 7,500 new doctors a year to roughly 2,500. And this newly small, newly elite cohort of American physicians would now train almost exclusively within a system funded, shaped, and overseen by the Rockefeller Foundation, working in close partnership with the AMA, state licensing boards, and the federal government. Dr. Naumov is careful to acknowledge the other side of this story too. Rockefeller, by the end of his life, had given away more than $500 million to charitable causes, an extraordinary sum for the era, and his biographer Ron Chernow has called him, flatly, the greatest philanthropist in American history. Spelman College, one of the most important institutions ever built for the education of black women in America, exists today in large part because of Rockefeller's investment, named for his wife, Laura Spelman Rockefeller. None of that, Dr. Naumov argues, is in dispute. What he wants you to hold alongside it is this: the same philanthropic machine that built hospitals and funded research also happened to permanently lock in a medical monopoly that eliminated the AMA's chief competition, homeopathy, virtually overnight. And the same George Simmons, who'd led the AMA's campaign against the homeopaths, had, earlier in his career, advertised himself to his own patients as a homeopathic physician. This is also where Dr. Naumov introduces Ivan Illich, the social critic whose 1976 book, Medical Nemesis, argued that allopathic medicine's celebrated effectiveness was, in significant part, a carefully cultivated myth, and that the system had actually introduced entirely new categories of harm. Illich coined the term iatrogenic, illness caused directly by medical treatment itself, and broke it down into three distinct forms. Clinical iatrogenesis, meaning a condition a doctor's own intervention directly causes. Social iatrogenesis, meaning harm produced by the broader mechanization of the medical industrial system itself. And cultural iatrogenesis, which Illich described, memorably, as a slow erosion of a population's own will to survive and heal itself. And Dr. Naumov backs this up with hard numbers. 1 in 25 hospitalized patients in America, by some estimates, acquires a hospital-borne infection during treatment. Malpractice rates in some specialties have climbed so high they're barely affordable. Dr. Atul Gawande, a respected surgeon and writer who has been candid about his own profession's failures, has publicly called for the adoption of simple surgical checklists, precisely because of how often things like wrong site surgeries still occur in American hospitals today. Dr. Naumov closes this section with a story he finds especially haunting: the story of Ignaz Semmelweis. In the mid-1800s, Semmelweis discovered something almost embarrassingly simple. When doctors washed and disinfected their hands before delivering babies, maternal deaths from childbed fever dropped from as high as 35% down to roughly 1%. But Semmelweis couldn't yet explain why this worked. Germ theory hadn't been established, and without an explanation his colleagues could accept, he was mocked, dismissed, and eventually committed to an asylum, where he died just 14 days later. He never lived to see hand-washing become standard medical practice. Dr. Naumov doesn't tell this story to make you distrust every doctor you've ever met. He tells it because it's the clearest example he's found of a pattern he believes still operates today. A medical establishment that doesn't always reward the truth, that sometimes rewards instead whatever story is easiest to standardize, easiest to monetize, and easiest to keep under centralized control. That brings us to the end of chapters 1 and 2. We've gone from Edward Bernays and the invisible government to the actual machinery of how American medicine became a monopoly and who built it and why. In Dr. Naumov's view, the through line connecting both chapters is the same. Whoever controls the framing of a crisis ends up controlling the solution that gets imposed on you, whether that crisis is political or medical. That's it for Episode 2 of Generation Sick. If you found yourself questioning something you'd always just assumed was settled history, good. That's exactly what this book is built to do. In the next episode, we keep tracing this story forward, because the system Dr. Naumov just walked you through didn't stop evolving in 1910. It's still evolving today, and it's still shaping the healthcare decisions being made for you and your family right now. If you want to be there when it drops, hit subscribe and turn on notifications. And if today's episode gave you something to think about, share it with someone who needs to hear it. That's how we restore the power to the people, one listener at a time. I'm narrating Generation Sick by Dr. Vic Naumov. I'll see you in Episode 3.